say
Boko.
na when you no share 18 bi atade odwane no.
Aha. Anapana ye dey to just say efi Dabema. Kwa masamai dobro ni ho keka ho police for ni ho no. You see there esun emo obia ete. Ente ya onimnya for Wilkinson ani police for impeni for omaba. And omo de omo nkrofo aba na yesi krom. Na yesi krom no lawyer pare we ni be he. Sport bi wo ho ani ye bie ni kitwe bi na nkrofo hwem no mo twen tampe. No more insa no. Like the one way being no one send your back and say baby I too. And no baby in for baby no baby almost store. Baby quanche lungu wa bla omo nyehwe. And almost catch almost omo dem. Obi wo ha obe tia no so de na yere ko hospital. Obe hwem no enya no kromo police for no ma sada aka bo mu sa.
I say ni pa kono nya na yere kura wa no wo ho a. Marriage of convenience.
And since said the MT, any commandant did Ekachobia say, Omunko dem, the Ankasa Moon better abonting.
And almost said the Antino Monsha dem no.
Like Omunya at the Papa Bianca, who way now, who's stopping our thing because Turkey, yeah, can Superman is how we did that.
Or no fool.
So we are not me pen no cranky to make it.
Oh, we are there in Nanum, and Anansa.
Or something, I talk about the no, I saw
it. Social distance.
We are say, either I'm part of Odidi. Mr. Sobasa,
now also in Saviano, or shall gloves and all this one in Saviano.
Debbie, yeah, no, me
wow. And you know, say so a bit of the actual room. Now, yeah, an opinion now bet church mu say, Emrano say a chose, ampa, yet me balk, and I want him say, so Monte.
I want to say, accent, say 21st March, Yanni passes our accent. A position, a position accent. Well, we Libra, almost sit down.
And he says, as a person for no be do much say, about 11-17, I got memory.
Sir, almost as almost
now, Jacob, pick up with a Kia no to know. Construction workers, road construction, and as a building construction now.
Yo, and Crawford almost see that man Crawford, labor for. Now, the Asia police for the before no plan say, a dino multino, and you saw the new dying. So they know Onim Emra, Onim Sabah, Emra, and so be a year more, and so be about one thing. And so I'm more about almost years born on your call, also Albany duty.
No, but Jacob, almost so getting a mom by an answer, my parenting will move so your Majuma.
I'm also getting it from an apparel, someone conquer. And Naka, come ya, you sit your munya, your mom, your bomb coco. Now, Omoko, your bomb coco, no more. But where I saw ya, I buy me father more is you money to know. And it's a command and it's so much more no for moon call. I'm watching Copinta, surgeon in the Baba.
Oh, so it means Omabo so in the corner, the MC no dear.
But any commander, no police commander. I'm about you, you must have your team, Bibia. Oh,
what did you know?
The beginning, they are Omokache commander, police commander.
Around 50 anti-vaccine protesters shouted slogans and burned face masks in Johannesburg on Wednesday, July 1st, a week after the start of Africa's first human trial of vaccine against COVID-19.
I'm not happy at all. I mean, this feels like 1981 all over again, or in the 1980s all over again. When the AIDS pandemic just broke out in SA, it feels like the same thing. It's like a replay, but this time they're doing it in our face.
The vaccine is being tested by Britain's Oxford University with local partner, the University of Witwatersrand. But the trial, consisting of 2,000 volunteers in South Africa, has also prompted a fresh wave of anti-vaccine sentiment, reflecting fears of Africans being used as guinea pigs. Community activist Walter Mashilo said the vaccine should first be tested on lawmakers and ministers' children before being used on poor people.
We want them to be in forefront of testing this vaccine to show leadership.
South Africa, which has the highest rate of infections on the continent, is the second country outside the UK to take part.
Who've had COVID-19. There's no cure for the illness, but scientists are investigating if convalescent plasma from the blood of these patients can help those gravely ill.
So convalescent plasma really is about the patient who's recovered after around 14 days has started to develop antibodies to the virus, SARS-CoV-2, and those antibodies lie in the plasma component of their blood. It was found to be very beneficial in SARS-CoV-1 and also in MERS-CoV. So we expect that it would also have the same effect in SARS-CoV-2.
Over 2,000 people have recovered so far in South Africa. Daniel Brink and his girlfriend are among those. They've donated their blood for clinical trials.
I had heard that there are antibody tests being done, in which case I would be able to contribute to that research as well as understand how much antibodies I would have. And in other countries, they send people back to work or give them opportunities to help others in areas where they have antibodies and therefore they can help. Maybe I could be a part of something like that.
It's not clear if experimental antibody tests will help understand COVID-19 immunity. Daniel and his partner are hopeful that in the end science will win.
So the first part will be obviously whether it actually can treat patients who have got COVID-19 to recover quicker and to have less deaths. I mean, this is obviously the ultimate outcome.
Research is also expected to reveal the extent of the outbreak.
This will then give us information to determine, one, how many people in the donor population at least developed antibodies but were never symptomatic. So these were people who were asymptomatic. And then we can get an idea of what the ratio is between symptomatic and asymptomatic cases. And that then also provides you with the true case fatality rate.
South Africa has suppressed the spread of the virus, but the fight is not over yet. It's also participating in global vaccine trials to find a cure. Julie Shara, CGTN, Johannesburg, South Africa.
As the world competes to develop a coronavirus vaccine, there are people in southern Africa who want to get involved. In the city of Johannesburg, 2 large-scale vaccine trials are underway. And a third will start in a couple of weeks. And there are thousands here who are willing to participate. You're having second thoughts? Do you think this vaccine could work?
I think so, and I hope so it works. Because this disease, man, I can't even, this feeling can't be described.
In a clinic in the township of Soweto, health staff administer the second dose of a new vaccine developed by Oxford University. And this is an excellent place to test it. The virus has run rampant in South Africa, with the number of infections hurtling past 600,000.
There are a lot of people who are dying out there. Just hope we find the right thing. Didn't do this for free.
Up in the lab, we found the trial organizer, Professor Shabir Mahdi, and he's got his own list of demands. If he can show these vaccines work in Africa, the pharmaceutical companies will have to distribute them in Africa as well.
What we need to understand is that there's no rush on the part of pharmaceutical companies to come and do vaccine studies in Africa. None at all. The only reason it's being done in South Africa is because I went out to convince people that you need to do the studies now in South Africa, on the African continent, and we can't wait for the studies to be done after the pandemic has passed.
It may take years, or even a generation, he says, to develop effective COVID vaccines. But he thinks everyone should get the benefit.
It's tight, it's cramped, it's very busy. They're doing 18-hour shifts in the lab with a new vaccine from the United States also being trialed. But here's the thing, will people take it if it works?
One trial participant warned us her friends and neighbors would never take a vaccine for COVID-19.
To be honest, more especially black people will be taking this lightly, because we have this mindset that this illness is only attacking white people, rich people and stuff. But it's like They're trying to say that this disease can see, it can feel like that you have money, and then it comes to attack you.
The coronavirus selects its prey. It's one of a number of myths and misconceptions that South African researchers are now encountering. And their work may be as important as the scientists in the lab. We join one team in Soweto.
What do you think about the vaccine?
The vaccine for me is like, it's like they're, here in South Africa, it's like they're going to kill black people.
Wow. Why do you say that?
Where does it come from?
Okay.
Okay.
Would you take the vaccine?
Never.
No.
Never. No.
You wouldn't, why wouldn't you take
Oh,
it?
yeah.
You never know, because like NATO Zoguti, okay, that vaccine, no coronavirus in it.
Yeah, thanks for your time, guys.
To build herd immunity, the majority need to vaccinate. But these residents won't be easy to convince.
They don't trust it because they feel that it's not real. You know, whoever invented the vaccine or wherever it originates from, they are bringing it here to kill people. So they believe there are things that have been done or that are put in that vaccine to reduce the number of population in Africa.
Scientists are fighting Africa's corner in an attempt to secure an effective vaccine. But they need to make the case on the streets for doubt. And
potential coronavirus vaccines should be tested in Africa. Jean-Paul Mira, head of intensive care at the Cochin Hospital in Paris, first asked if he could be provocative before questioning Camille Locht, head of research at the National Institute of Health and Medical Research in Lille, whether a study into using the BCG vaccine should happen in Africa. He compared it to past studies into AIDS that tested treatments on prostitutes. WHO Chief Tedros Adhanom Ghebreyesus was one of many who condemned the tone of the conversation as being racist.
Faire cette étude en Afrique où il n'y a pas de masque, pas de traitement, pas de réanimation, un peu comme c'est fait d'ailleurs pour certaines études dans le sida, où chez les prostituées, on essaye des choses parce qu'on sait qu'elles sont hautement exposées et elles ne se protègent pas. Qu'est-ce que vous en pensez ?
Alors vous avez raison, et d'ailleurs on est en train de réfléchir en parallèle à une étude en Afrique justement pour faire ce même type d'approche avec le BCG, un placebo. Je pense qu'il y a un appel d'offres qui est sorti, il va sortir, et je pense qu'on va en effet sérieusement réfléchir à ça aussi. Ça n'empêche pas qu'en parallèle on puisse réfléchir à une étude aussi en Europe et en Australie.
Developer Novavax Inc. said on Monday that it is starting a mid-stage study of its experimental COVID-19 vaccine in South Africa, as the country experiences a surge in coronavirus cases. The company said in a statement that the trial study will be conducted on about 2,665 healthy adults and will evaluate safety and immunogenicity in about 240 medically stable HIV-positive adults. South Africa is the world's fifth worst affected country, with 583,653 recorded coronavirus cases and 11,677 deaths, according to a Reuters tally. The Bill and Melinda Gates Foundation is providing a $15 million grant towards the clinical trial, the company said. Novavax said it intends to initiate the Phase 2 portion of this trial in the United States and Australia in the near future, and it would include about 1,500 people. The US government in July awarded Novavax the $1.6 billion to cover testing and manufacturing of a potential vaccine for the coronavirus in the United States, with the aim of delivering 100 million doses by January. Last month, AstraZeneca said late-stage trials of its experimental drug developed in conjunction with Oxford University